Preeclampsia is something that not only has affected many women across the world, but has affected me and my family personally. My wife and I were lucky enough to bring in two beautiful children into this world, and I say lightly, I did nothing but have some fun for 30 seconds. And then my wife endured pregnancy, labor, postpartum, and everything in between twice. Both times, however, my wife faced the scary truth that is preeclampsia. If you're pregnant, trying, close to term, or a first time dad about to witness your wife give birth to what will quickly become your entire world, preeclampsia may be something you want to keep an eye out for. Preeclampsia is thought to be caused by an issue with the placenta's development and how it interacts with the mom's blood. It affects between 5 to 8% of all pregnancies in the United States and is the leading cause of maternal and infant death globally. Symptoms of preeclampsia can be persistent: high blood pressure greater than 140/90, protein in the urine, headaches, swelling, and edema, visual disturbances, and upper abdomen pain. There is not a true cure to this outside of delivery of the baby. If detected early on, doctors can administer a steroid shot to the mother, and which will help develop the fetus's lungs and prepare them for delivery. With our firstborn child, my wife and I did not know what to look out for, and my wife had severe swelling in her leg, high blood pressure, grade 4 pitting edema, and a doctor who didn't seem to care that much. So if this ever does become a concern for you or your family, please get a second opinion and speak up. We ended up having to do an emergency induction to deliver our child. This does not only affect the mother during pregnancy, my wife was affected by this in postpartum as well, because 2 days after we came home with our newborn as first-time parents, I had to bring my wife back up to the emergency room because she had a blood pressure of 194/108 and was in early stages of heart failure. With her second pregnancy, she was in the hospital a month prior to even delivering due to preterm labor and received steroids as I mentioned earlier, to try and develop our baby's lungs. What the doctors were able to do did work, and my wife made it 4 more weeks before our second child was born. Still slightly early and still an emergency induction due to hypertension, but she delivered a healthy and safe baby. There were other complications from this night, but I'll save that for another video. Gentlemen, hold your wives and any mother you know near and dear to your heart, because what they go through to bring life into this world cannot just be overlooked and should be celebrated more than it already is.